The foundation's primary aim is to cure brain cancer, and there's a lot of different approaches that can be taken to get to that goal. Most of them is understanding the science or the medical history behind the disease. I think the Scientific Advisory Board is really here to try to prioritize what science will bring us a cure sooner rather than later. Maybe what clinical trials are most promising, perhaps what young investigators need to be funded to bring this science forward. I think also, we're with the breadth of the entire Scientific Advisory Committee, I think we understand globally what's going on in the area of brain cancer. And we'd really like to try to bring some of that science and some of maybe those clinical trials to Australia to help our brain cancer patients in Australia. And I think it'd be wonderful if we can do that as well. Well, I have a personal connection to brain cancer. I lost an older brother to glioblastoma 20 years ago. And I remember at that time talking to his neuro-oncologist and realizing there was really not many options for brain cancer patients then. And there still isn't at this point, where there's a lot promising things working their way through. But I found myself working for a number of years on new drugs for breast cancer or lung cancer, and realizing that the fundamental biology that drives the breast cancer or the lung cancer is the same fundamental biology driving diseases like glioblastoma. But there's challenges there in brain cancer, and we actually needed to design new drugs specifically for brain cancer. And I am trained as a medicinal chemist to design drugs for cancer. And so I kind of took it on myself and kind of mobilized this team to start thinking about designing drugs specifically for brain cancer based on this fundamental biology that's been helping breast cancer or lung cancer patients and other things. So my connection is a personal one. And I think all of us who work in the pharmaceutical industry want to help patients, but it's this personal connection that's probably driven me towards trying to help brain cancer patients. I chaired or co-chaired, co-organized a conference on designing new drugs for brain cancer and what's kind of preventing new drugs from getting there. And one was, we do need to design our drugs specifically for brain cancer. And there's a unique challenge to brain cancer, and that is the brain has a barrier that prevents foreign substances from getting into it. It's a very privileged organ, right? You don't want just anything getting into your brain. So there's something called the blood-brain barrier that prevents a lot of drugs, 95+% of drugs, from not getting into the brain. And of course, if the tumor is in the brain, you need to get that drug to that tumor, which is in the brain. And so we have to actually design drugs to cross the blood-brain barrier. It can be done, but you have to really think about exactly what you're doing when you make the molecule, so that it will get there and help inhibit that biological process that you're trying to inhibit. So that, as a chemist, is something that I can do, or my team can do. So that's probably the biggest challenge in designing drugs, is to get the drugs to the tumor in the brain. But there's a lot of compelling biology to allow us to do that. And so I've been very fortunate to lead research teams and lead development teams in the clinic and actually design drugs for brain cancer and take those into the clinic. And some of those are moving forward as we speak. And I hope that they will come to fruition and actually help brain cancer patients once they finish their clinical trials. When we talk about cancer in general, we're usually talking about some biological pathway that's kind of been turned on and kind of going at full bore and needs to be pulled back a little bit because it's sending signals into your cell to grow, divide, to migrate, to invade programmed death, all these hallmarks of cancer. And so our goal is really to just try design drugs that will inhibit these key pathways. One of the key pathways for many cancers, but it's about 80 to 90% of brain cancer, glioblastoma, is a pathway called PI3 kinase. Anyway, I led the research team and the development team for a number of PI3 kinase inhibitors and actually mobilized the team to design a drug that would cross the blood-brain barrier, a PI3 kinase inhibitor. And it is moving forward as we speak, and we hope that it will help. But it is just one of many pathways that we know are going on in brain cancer, and we just need to design the right kind of molecules that will stop that unintended signaling to grow and divide and multiply and invade, which is the hallmarks of cancer. I'm very optimistic about the scope of where we're headed in terms of brain cancer. I am now seeing many more companies actually designing drugs for brain cancer, either for primary brain cancer like glioblastoma or secondary brain cancer such as a metastasis from lung cancer or breast cancer. And so I'm very hopeful that we'll see more and more drugs designed for brain cancer, both targeted therapies that would inhibit some of these specific biological pathways. But I'm also very excited about an area that's really emerged over the last decade, and that is in cancer immunotherapy, where you're actually trying to help your own immune system fight off the cancer, because the cancers have figured out how to trick your immune system, and there's drugs that can help reveal that it's not what the body wants. And those have made great progress in unmet medical needs like melanoma and such. There's a lot of optimism that can also be applied to brain cancer. It's a challenge to come up with any drug for any disease, including brain cancer. And this is an area that is still a challenge, but I'm very, very hopeful that area too will be fruitful and bring us some new therapies for brain cancer patients. So yes, I'm very excited about where we are now and where we're headed. I love the outdoors, so I spend a lot of time hiking, biking, cross-country skiing. We have a place up in the mountains that we spend a lot of time, but I also have a big passion for the ocean. I'm an avid scuba diver, and probably another passion is trying to protect our oceans and thinking about it from the science side of things as well, but loving to get out there and exploring the underwater environment as well.